today we talked about a project that utilised large data from the Mayo Clinic Neuroimmunology Laboratory of patients that were tested for autoimmune encephalitis over a 2-year period. So in this study we evaluated over 42,000 patients who were tested for autoimmune encephalitis to look at the frequency, the age and the sex associations. And we did this because at present there are very limited studies that incorporate large data in rare diseases such as autoimmune encephalitis. So most studies that are done in autoimmune encephalitis are often single centre studies of cohort descriptive studies that have helped us understand the clinical phenotypes and clinical outcomes and have really paved the foundation for autoimmune encephalitis. But what we were interested here is to try and take a big data approach to autoimmune encephalitis and to understand it with that big picture perspective. So our findings were, in terms of frequency, we looked at the serum and CSF of adults and children tested of these 42,000 patients, and we identified that there were neural antibodies in between 3 to close to 6% of these patients. And of those that were CSF and serum positive, we looked at the breakdown between adults and children and serum and CSF. So in adults, we saw in both serum and CSF that there were 3 antibodies that were most commonly detected in the lab, and these were NMDA-R, GAD65 and LGI1. And this is in contrast to children. So when we looked at children tested in CSF, we found that almost 90% that were positive for neural antibodies were actually positive for NMDA-R, and this is followed by a small proportion of patients, about close to 9%, that were GAD65 positive. Then in serum we saw in children again that NMDA-R was the most frequently detected neural antibody. But interestingly in children we found that about 30% were MOG-IgG positive. And this really highlights that MOG-IgG is an emerging biomarker for autoimmune encephalopathy in children. In terms of age and sex associations, we looked at age and the associations with different neural antibodies, and we found younger age was mainly associated with the detection of NMDA-R and MOG antibodies, and this fits with our understanding of NMDA-R often being detected in young women with ovarian teratoma, and MOG often afflicting young children and young adults. Then we saw a clustering of the remaining neural antibodies in this sort of 70 age group, and this may reflect ageing or paraneoplastic associations in these patients. For sex associations, we observed that NMDA-R and GAD65 were associated with female sex, and that male sex predicted LGI1 autoimmunity. And these findings are interesting, I think, particularly for LGI1, just because we don't really understand why males are so affected. And it's unclear, this is in contrast to many autoimmune disorders that mainly affect females. So together these findings give us a big picture perspective of autoimmune encephalitis, of the frequently detected antibodies and their age and sex associations. And they may inform our clinical practice and also represent some pathophysiological understanding of these antibodies. This is the beginning, I think, of future research that's going to look at integrated data from many multi-centres, serological data tied with clinical data, hopefully in future studies. I think that this study helps us clinically triage our patients. So when we're looking at a young patient that's been evaluated for autoimmune encephalitis, we can surmise that the more likely antibodies to be detected at present that are known are MOG and NMDA-R, whereas in older patients we're perhaps going to get a different spectrum of neural antibodies in that population, such as LGI1, Caspar-2, ANA1, GABA-B receptor. So they're the main clinical interpretations of this study.